Hi, today we are going to talk about snoring. Snoring is a common and often bothersome sleep-related condition that affects many individuals, especially adults. It occurs when there is an obstruction or narrowing in the airway during sleep, leading to noisy and often repetitive breathing sounds. Snoring can vary in intensity and frequency, ranging from mild to severe, and it can have various underlying causes. Let's delve into the details of snoring. Mechanism of snoring. During sleep, the muscles in our body, including those in the throat and airway, relax. For some people, this relaxation can cause the soft tissues in the throat to collapse, partially obstructing the airflow. When you breathe in, the air has to pass through this narrowed space, resulting in vibrations of the relaxed tissues. These vibrations produce the characteristic snoring sound. Causes of snoring. Several factors can contribute to snoring, including: Number 1, anatomy of the airway. Certain physical attributes, such as having a long soft palate, large tonsils, or a deviated septum, can narrow the airway and increase the likelihood of snoring. Number 2, obesity. Excess weight can lead to the accumulation of fat around the neck and throat, further narrowing the airway. Number 3, age. As people get older, the muscle tone in the throat decreases, making snoring more common among older adults. Number 4, sleeping position. Sleeping on your back can cause the tongue and soft palate to collapse to the back of the throat, obstructing airflow. Number 5, alcohol and sedative use. These substances can relax the throat muscles, making snoring more likely. Number 6, nasal congestion. Conditions like allergies, colds, or sinus problems can block the nasal passages, forcing you to breathe through your mouth and potentially increasing snoring. Number 7, sleep apnea. In some cases, snoring can be a symptom of sleep apnea, a serious sleep disorder where breathing repeatedly stops and starts during sleep. Effects of snoring. While snoring itself may not always be harmful, it can lead to certain consequences. Number 1, disrupted sleep. Snoring can disturb both the snorer's sleep and their partner's sleep, leading to daytime fatigue and irritability. Number 2, the strain on relationships. If one partner's snoring disrupts the other's sleep, it can cause tension and strain in the relationship. Number 3, health risks. In some cases, chronic and loud snoring can be a sign of sleep apnea, which is associated with an increased risk of heart disease, high blood pressure, and other health issues. Treatment and management. The treatment of snoring depends on its underlying cause and severity. Some common approaches include: Number 1, lifestyle changes. Losing weight, avoiding alcohol before bedtime, quitting smoking, and sleeping on your side can help reduce snoring in some cases. Number 2, nasal decongestants. If nasal congestion is contributing to snoring, using nasal decongestant sprays or strips may be helpful. Number 3, oral appliances. Dentists can prescribe oral devices that help keep the airway open during sleep, reducing snoring. Number 4, continuous positive airway pressure, CPAP. For individuals with sleep apnea, a CPAP machine delivers a continuous flow of air through a mask, keeping the airway open during sleep. Number 5, surgery. In severe cases or when anatomical abnormalities are the primary cause, surgical procedures to address the obstruction may be considered. Anti-snoring throat exercises. Number 1. Repeat each vowel, a, e, u, u, out loud for 3 minutes a few times a day. Number 2. Place the tip of your tongue behind your top front teeth. Slide your tongue backward for 3 minutes a day. Number 3. Close your mouth and purse your lips. Hold for 30 seconds. Number 4. With your mouth open, move your jaw to the right and hold for 30 seconds. Repeat on the left side. Number 5. With your mouth open, contract the muscle at the back of your throat repeatedly for 30 seconds. Tip: look in the mirror to see the uvula, the hanging ball, move up and down. Number 6. For a more fun exercise, simply spend time singing. Singing can increase muscle control in the throat and soft palate, reducing snoring caused by slack muscles. If you or someone you know experiences chronic and disruptive snoring, it's essential to consult a healthcare professional or a sleep specialist for a proper evaluation and personalized treatment plan. And I hope this information will help you to relief from snoring. So, stay connected and keep watching A to Z Healthcare channel for more valuable health information. Thanks for watching.